A client calls the clinic and tells the nurse that her daughter has just been stung by a bee on the arm. She is worried that her daughter will have a severe reaction. What should the nurse do? A. Instruct the client to keep the arm elevated until swelling goes away. B. Tell the client to call back if the condition worsens. C. Ask the client if her daughter has ever been stung by a bee in the past. D. Advise the client to bring her daughter to the emergency room. The answer is B. Tell the client to call back if the condition worsens. The nurse does not have reason to suspect that the child will have an allergic reaction before symptoms are present. Thus, the patient should call back or come to the emergency room if symptoms present. The nurse cares for an immobilized patient on the surgical floor. Which of the following nursing considerations is essential for preventing ulcerations? A. Providing a well-balanced diet. B. Teach client the importance of coughing and deep breathing. C. Orient client frequently. D. Frequently turn and reposition patient while also providing skin care. E. Use compression stockings or TED hose. The answer is D. Frequently turn and reposition patient while also providing skin care. There are many possible complications from immobilization. Decubitus ulcers are one of these complications. It is essential to turn and reposition the patient at least every 2 hours while also maintaining skin integrity with skin care. Many other complications may result from immobilization and each have specific, related nursing considerations. Immobilization can result in desensitization and disorientation, so it is important to orient the client frequently. A well-balanced diet can promote better nutrition to prevent osteoporosis, negative nitrogen balances, and hypercalcemia from being bedbound. Compression stockings and TED hose are essential to prevent thrombus formation from stagnant blood flow in the lower extremities, which may lead to pulmonary emboli. Coughing and deep breathing is important to prevent the stasis of respiratory secretions, which could lead to hypostatic pneumonia. The nurse is caring for a 2-year-old child with chickenpox. While bathing the patient, the nurse's N95, surgical respirator, mask becomes saturated. The nurse should A. Exchange the mask for a new mask immediately. B. Dry the mask with the in-room hairdryer. C. Wait until the patient care is complete and replace the mask. D. Wipe with mask with a clean towel. E. Place a new mask over the old mask. The answer is A. Exchange the mask for a new mask immediately. Varicella, chickenpox, is a condition requiring airborne precautions. An N95 mask is considered ineffective when wet and needs to be replaced immediately. The nurse is preparing to enter a contact isolation room where she will perform a bed bath. It is reasonable to expect her gloves to become soiled at some point during the administration of care. While preparing to enter, the nurse A. Wears a single pair of clean gloves. B. Wears 2 pairs of clean gloves. C. Wears a pair of clean gloves under a pair of sterile gloves. D. Wears a single pair of sterile gloves. E. Wears 2 pairs of sterile gloves. The answer is A. Wears a single pair of clean gloves. In the interest of infection control, it is best to only wear 1 pair of gloves at a time. While giving a bed bath, it is not necessary to wear sterile gloves. If the gloves become saturated, remove the gloves, perform hand hygiene, and wear a new pair. International Normalized Ratio, INR, of 1.1. B. Alanine transaminase, ALT, 1200 dPl. C. Ringing in the ears. D. Higher blood pressure. E. Diarrhea and loose stools. The correct answer is B. Alanine transaminase, ALT, 1200 IU per liter. The nurse should be concerned about acetaminophen toxicity, as the recommended daily dose of acetaminophen is 4 grams for adults, and this patient has exceeded this amount. 3 500 mg tablets every 3 hours is equal to 12 grams in a 24-hour period. Acetaminophen toxicity may manifest with nausea and vomiting in the first 24 hours and right upper quadrant abdominal pain afterwards due to liver damage. Tinnitus, high blood pressure, and diarrhea are not symptoms of acetaminophen poisoning. An international normalized ratio, INR, of 1.1 is within normal limits, but may be trending upwards, as the liver is responsible for producing clotting factors. Liver function tests should always be done when acetaminophen poisoning is suspected. Aspartate transaminase, AST, and alanine transaminase, ALT, values above 1000 IU per liter suggest hepatic damage.